If you're on Social Security or disability benefits, listen up. The Trump administration is asking the Supreme Court to clear the path for thousands of federal workers to be laid off, including at the Social Security Administration. Why should you care? Well, if you remember, they've already laid off 7,000 workers that has strained the Social Security system, including customer service, where people have reported having to wait 3 hours on the phone to get essential services that seniors depend on. Well, the president is asking the Supreme Court to allow another round of mass layoffs, and I am going to walk you through what this means for specific services that seniors need from the Social Security and what you can expect and how that's going to impact benefits going forward. I am Kwame Kwade, a personal finance expert. I have been working to help seniors get the benefits they deserve for the past 15 years. I also teach finance to graduate students. I'm an adjunct professor at one of the most prestigious universities in the United States. So let's dive in. So, what is happening and how is it going to affect your benefits and why should you care? Well, the Trump administration has asked the Supreme Court to allow immediate mass layoffs across federal agencies, including the Social Security Administration, as part of sweeping efforts to downsize government. You know, President Trump has been big on downsizing the federal government, and this is part of that initiative. With more than 73 million Americans relying on Social Security, any disruptions in the SSA's staffing can directly affect timely payments and access to critical services, especially for seniors, people with disabilities, and low income families. Now, a federal judge temporarily blocked the layoffs, but the administration is pushing for a rapid action, and that's why they're going all the way to the Supreme Court to ask for relief so that they can continue to push this widespread layoffs, including at the Social Security Administration. So, what's behind this push for layoffs? Well, President Trump released an executive order for reductions in force. In February, President Trump signed an order calling for large scale layoffs at 21 federal agencies, including the Social Security Administration, Health and Human Services, which handles Medicaid and Medicare, and the Veterans Affairs. Now, the Veterans Affairs alone is losing 80,000 employees, which has created a lot of stress for a lot of veterans who depend on critical services from the VA. The layoffs were halted by a judge who ruled that such sweeping changes require congressional approval and must follow strict legal procedures. While the president and his team disagreed, the administration argues that keeping these employees is a waste of taxpayer money, but unions, nonprofits, and 20 plus states say the cuts are unlawful and would harm public services, including the Social Security Administration, where there's already stress from the 7,000 people that were laid off just recently. The Social Security Administration is already at a 50-year staffing low. Now, let me explain what that means. They are at a 50-year staffing low, but then the number of people claiming Social Security and disability benefits is at an all-time high. So there is a mismatch. While benefits are being claimed at a higher level, staffing levels are falling down. And so you have critical stress on the Social Security service, serving more than 57,000 workers for 73 million beneficiaries, compared to 67,000 workers for 60 million in 2010. So 2010, they have 67,000 people working, serving 60 million people. In 2025, they have 57,000, which has now been cut by 7,000 already. So there's now 773 million, and now they want to lay off more people again. Doge-led plans will eliminate 7,000 more jobs, which is 12% of the workforce, and close dozens of field offices, further straining an agency already struggling with long wait times and service delays. Field offices are vital for seniors and disabled people who lack internet access. Closures and layoffs mean fewer people can get help with applications, appeals, or urgent personal issues that affect their Social Security and disability benefits. Now, why should you care? How does this impact you today? Even a short delay in Social Security checks can threaten the ability of over 7 million seniors to pay for food, rent, or medicine. And you may think that's not possible, but there's a lot of human involvement in processing Social Security benefits, with 42% of seniors reporting they could not afford basic needs without their Social Security benefits, meaning that they expect and rely on Social Security being delivered on time every month. And it's never been late. And now there's a real chance that that could happen if the system is stressed further by these layoffs. More than 11 million disabled Americans rely on Social Security Administration programs, and cuts will mean even longer waits for disability decisions, already averaging 225 days, with some states facing even year long backlogs. For example, California and New York, bigger states with bigger load of cases, now are facing multiple years to just get through getting approved for disability benefits, for benefits that some people have paid into and now need the help, and they are struggling to get it. Research shows field offices closures lead to about 16% drop in disability benefit receipt in affected areas, hitting the most vulnerable, because people get frustrated about the application process and how long it takes. Layoff at agencies like Health and Human Services have already slashed support for Meals on Wheels, energy assistance, and other programs critical to seniors. So you may think that this may not affect you, but there are other areas that these cuts can have devastating effects, including programs like Meals on Wheels that depend on these services. The departure of seasoned employees managing complex computers and benefit processing raises the risk of technical failures and benefit interruptions. Local offices in rural and underserved areas face the steepest reductions, making it even harder for those without reliable transportation or internet access to get help. So, what can seniors and families do? Well, number one, monitor updates from the Social Security Administration advocates groups about office closures, staffing changes, and your right as a beneficiary. If you experience delays or problems accessing benefits, keep records and seek help from legal aid in your community, senior centers, and agency for aging, and advocacy organizations like the AARP in your area. And then contact your elected officials. This is probably the best way to get in front of a Social Security Administration if you have a financial issue and you are experiencing massive delays that is going to cause you financial stress. Contact your elected representative, your senator, your House of Representative, and get them to help you, because there's nothing that gets response faster from the Social Security Administration than a letter from the a lawmaker. So use that to your advantage and get the help that you need. And if possible, set up direct deposit. Keep copies of important documents that the SSA might need, and explore online services. So go online to ssa.gov, create an online account so that you can access your benefits, stay informed, and be able to process settings transactions that you can do online, including updating your direct deposit information, your address, phone number, email, etc. So let me know what you think about these layoffs. Do you think they are justified? Do you think that the government, laying off these people is the right thing to do, because the money being spent on all these workers at the Social Security Administration currently is a waste of money, taxpayer money? What is a good number? How many people should the Social Security Administration have, given that there are 73 million people that are on benefits and only 57 people supporting them, whereas previously for 60 million beneficiaries, there was a higher number of employees. So, what is the right number? I want to hear from you. Go in the comments and let me know what you think. What's the bottom line? Experts warn that continuous staff reductions could lead to the system collapse and interruption of benefits, putting millions at risk. Seniors, people with disabilities, and low income families are likely to face the most severe consequences of this layoff if they proceed unchecked. And the future of Social Security depends on public awareness, advocacy, and holding policymakers accountable. So make your voice heard. If you're unhappy about this, let your elected representative in Congress know, let your senator know, and all the voices help, because recently we won a big victory when they wanted to take the phone system away from seniors calling the Social Security Administration. We reported on it. A lot of news channels also did, and a lot of seniors made noise because they called their representatives. And after a few weeks, the plan was scrapped or significantly scaled back. So do not think your voice does not matter. It does matter, but enough people need to make noise to make sure that this is not the direction that you think they should be heading, and that they need to proceed in a way that benefits seniors but does not interrupt your benefits that you depend on and rely on. So I'm shifting gears here. If you are on Medicare and you're not happy with your plan, or you think you may be up for a better plan than you have right now, or if you're turning 65 and don't know what to do about Medicare, I have some good news for you. Here's the first thing: there are 24,000 Medicare plans out there that you have to sort through. And a lot of seniors struggle to do that because you have to figure out what is right for you, how much it costs, what are the restrictions, what are the doctor networks you need, what are the prescription drugs that are covered. It is so much to weed through. That is why a whopping 90% of all seniors are in the wrong Medicare plan. And that's costing you money, costing you your health. There's nothing worse than needing medical care and finding out your insurance does not cover it, or it doesn't even provide financial support to help you. That's why we've partnered with a strong advocacy organization, Chapter Medicare. Now, the Trump administration recently sued a whole bunch of Medicare advisory companies because they were misleading seniors. And so we come at you with Chapter because we believe Chapter is the right company to work with, because one, their whole mission is to make Medicare simple, help you understand, choose, and use your Medicare benefits. And one of their co-founders actually has a personal experience with this, which helped push him in this direction. He watched his parents struggle to navigate the whole Medicare enrollment process. They end up paying hundreds of dollars that they shouldn't have paid. He realized how terrible this experience was. And another co founder actually wrote a book about it, how to make it uncomplicated so that you can understand what you're getting yourself into, see all the options, and then make an informed decision yourself. So, one of the big reasons that we are partnering with Chapter is because they don't pay their agents to push specific plans. They are there to see what is in your local area that best fits your needs and then help you make an informed decision. So, when you call them, what are you going to get? Well, you're going to be speaking to these people. These are real agents on their website that are there to help you. And when you call them, they will show you every Medicare option available to you, including detailed information about doctors, specialists, prescription drugs, hospitals, co-pays, and then help you compare it to traditional Medicare. These guys are advocates for you. They want to be in your corner and help you pick the best plan. They are not advocating for an insurance company. They are your advocates. So call them at 539-205-2147 or go to their website, askchapter.org/insider. Guys, they're highly rated by the Business Bureau. They have tons of 5-star review. One of them, which I wanted to show you here, from Michelle S., who had a situation, a big deal with cancer diagnosis, trying to sort through her Medicare plan. She moved out of state, so she had to get a new plan and call Chapter. And what a story. And now she's scheduled to get surgery for her cancer treatment because Chapter helped her get into an insurance plan even when the window was closed. So here's the thing: you may have a very short window to do this. If you are getting on Medicare at 65 or you want to switch, call them. They'll help you figure it out. And finally, if you want to stay on top of news and updates, anything in and out of Congress that can affect your benefits, sign up for our newsletter. Go to this website, benefitsinsider.co/subscribe, or go to the top of our YouTube channel. There's a link in the description. Put in your email address, and we'll keep you updated not only on the news, but give you money saving tips and discount opportunities that are available to you. So, thank you for watching. Until I see you in the next video, thank you.